Today we're learning about some sleep disorders. In case you have one, you're struggling with one, you can see some of the symptoms and get some help. So let's jump right in. The first one is narcolepsy, and this is like falling asleep throughout the day, so uncontrollable daytime sleepiness. Now, if you're just not sleeping, of course you're going to be tired, but sometimes even if you are sleeping, you're going to have uncontrollable daytime sleepiness. So let's check out these symptoms here. First, excessive daytime sleepiness. Second, cataplexy. Cataplexy is really interesting. I'll leave a link below so you can kind of see what happens. Basically, you're losing muscle tone and your muscles are just relaxing and you don't really have control anymore. And that happens while you fall asleep. So, this can really impede life, particularly with driving, right? If you have really bad narcolepsy, I don't believe you can have a driver's license. And there are some things you can do, but again, it's fairly unknown what exactly is going on here. Hallucinations can be another one. If your REM sleep is being interrupted, then your brain can kind of force you into REM while you're awake, and that can be observed as hallucinations. We have sleep paralysis. Just because you've experienced sleep paralysis doesn't mean you have narcolepsy, but it is a symptom. And then just disrupted sleep in general. Some of the treatments, there is no cure for narcolepsy, unfortunately. It's probably some genetic thing going on. They are working on finding what genes are causing narcolepsy, and from my reading, it seems like they're making some progress on that, so that's pretty good. There are some healthy lifestyle changes you can make, so having a good diet, avoiding caffeine late, minimizing drug and alcohol use is all going to help. Having a exercise routine that's consistent, and a consistent sleep schedule all can help with narcolepsy. That's part of sleep hygiene. We'll learn about that in the next video. You can go to your doctor. There are some drugs you can take. One of them is SSRIs. So we learned about these with depression, and it increases our serotonin levels. And there's a really interesting interplay between sleep disorders, serotonin, because serotonin does help regulate our sleep, and sleep disorders and depression. So SSRIs do seem to help. Another medication is some stimulants they can give you to try to keep you awake throughout the day so that you're not randomly falling asleep at a unwelcome time, I guess. And then there are some more specific medications that I'll let you and your doctor talk about if you're struggling with narcolepsy. Sleep apnea. This one is a little bit more common. 1 out of every 15 people have this. And what happens is your breathing is being interrupted for 10 seconds or longer. What's going on is your throat or your tongue are relaxing and then blocking your airway, and then that's causing you to wake up over and over throughout the night. So if you're snoring, that is a symptom that you have sleep apnea, so just be aware of that. If you're a bad snorer, it might be worth going and getting this checked out. Some of the risk factors are being overweight. So as we gain weight, we gain mass overall, and that includes up in our throat airway region. And then this just increases the likelihood that your airway is going to be blocked. So losing weight is fairly effective, so that's some good news. I found a really interesting study that looked at people whose BMI is over 30 have a 90% chance of having sleep apnea, or up to a 90% chance of having sleep apnea. So that's pretty alarming. Smokers as well. Smoke is going to inflame these areas, and that can increase your risk of sleep apnea. Alcohol use, just being over the age of 40 is a risk factor. And then we have some anatomical things. So large neck, tongue, tonsils. Again, sometimes this stuff is just genetic, and there's not a whole lot we can do about it. So as far as treatment goes, you can go to your doctor. They'll do a sleep study on you. Basically, you go in, they'll hook you up, they'll monitor your heart rate, your oxygen saturation, your breathing rate. They'll measure brain waves to see what your brain is doing, and then they can determine if you are actually waking up or if you're actually sleeping throughout the night. I know a person who has gone through this. They're waking up thousands of times a night and not getting any REM sleep, and we've learned how bad that is for our health. So, just be aware of that. And one of the main treatments is a CPAP device. So right here, we have a continuous positive air pressure machine. Basically what it does is you hook it up to your nose, and it maintains an air pressure so that your airway doesn't close down. And now a lot of people don't want to wear this when they sleep, so they'll avoid, going in and getting diagnosed. But you should really look into it, because there's other reasons, right? If you lose weight, for instance, losing weight is fairly effective for sleep apnea if you have weight to lose. So again, just be aware of that we'll learn about how to lose weight in a healthy way in this class. But the CPAP device, it can really help. And if you're not getting that sleep, the health ramifications are huge. So, make sure you're taking care of this if that's what you need. And then there are some positional therapies as well. So you can get little mouthpieces that kind of hold your jaw in a certain way to keep your airway open, or just how you sleep in your bed. And I'll let you and your doctor discuss that if that is something you are struggling with. And then last but not least is insomnia. And this is more generalized and probably more common. This is just difficulty staying and falling asleep. And insomnia does tend to increase in rate as we get older. It's related to stress and worry. So a lot of times you have a bunch of thoughts that don't quite let you go to bed at night. Circadian rhythm is important because there are hormones that go on with the light and dark cycles. And if those get out of balance, kind of like serotonin and melatonin, and there are a few others, then that can make sleep difficult for us. And then as far as treatments go for this, cognitive behavioral therapy, we talked about this with mental health issues like depression and anxiety. You can do this for insomnia as well, because again, you're learning how to control your thoughts, how to ignore others, how to change and modify them so that they don't become destructive, right? Substance control is super important. So alcohol, marijuana, these interrupt our REM sleep, which are then going to throw off our circadian rhythm and all kinds of problems there. And then just general sleep hygiene, which I'm going to leave for the next video. So thanks for watching. I will see you in the next video on sleep hygiene.